In our study of the lower limb muscles, there are 9 compartments or groups of muscles that we want to study and learn. And of those, this presentation will show us the posterior hip muscles. So here is a picture showing 4 compartments in the hip and the thigh. And it turns out, even though the muscles we're going to focus on here are the posterior hip muscles, you can see a very small amount of them up in the hip area. They wrap quite a ways around the lateral side of the hip area. And so you can see a little bit of them here, along with the anterior hip muscles, the medial thigh muscles, and the anterior thigh muscles. Much better view for the posterior hip muscles are here in a lateral view, where we see them above the anterior muscles, the anterior thigh muscles, and the posterior thigh muscles, or in this type of a view where we're looking straight from a posterior aspect. Obviously, the lateral view shows us the best picture of all of these muscles. So let's look at them from that lateral view again. There are 4 posterior hip muscles we want to study. What makes them somewhat easier is that 3 out of the 4 muscles here are gluteal muscles: gluteus maximus, gluteus medius, and gluteus minimus. Now, in the picture, the gluteus minimus does not show. We have a line indicating where it would be, which is directly deep to the gluteus medius muscle. Gluteus medius muscle is superficial. Gluteus minimus muscle is deep. So in any superficial picture, this is not going to show. The 4th muscle is a little muscle with a very long name called the tensor fasciae latae. That muscle you can see is that anterior-most muscle. That was the little bit we could see when we were looking at the anterior picture just a moment ago. So let's take these a little bit at a time. It's easiest really to start with the gluteus medius and the gluteus minimus muscles, because they have the same origin and the same insertion. And you can probably see that from the picture. You can see the iliac crest in the picture, and right below that is the gluteal surface. Both muscles anchor on the gluteal surface, and both muscles insert on the greater trochanter of the femur. You can see both muscles in the line drawings there in the white area on this slide. The second picture shows the position of the gluteus minimus muscle underneath the gluteus medius. So studying these 2 together, you get a lot learned very quickly. The other 2 muscles, let's take the small one in front first, the tensor fasciae latae. It's the most anterior, it's very narrow, and it really doesn't have much to do with movement. It's an interesting muscle because it anchors up on the ilium, and yet its insertion is all the way down on the tibia. And you can see in the picture a band or belt of white connective tissue that runs all the way down the lateral side of the thigh. And the tensor fasciae latae uses that connective tissue to anchor itself down onto the tibia. It isn't involved in movement, but it does support. When it contracts, it tightens that connective tissue and supports the lateral side of the hip and the knee. So it's very, very important muscle in balance. So it's easy to find and a little bit challenging to get the origin insertion, but not too bad. So that's the little tensor fasciae latae. And the 4th muscle then is the gluteus maximus. And it actually partners with that tensor fasciae latae just a little bit. This gluteus maximus is, of course, the big buttock muscle, the large one there. And its number one job is moving the femur in your walking or running motions. It pulls the femur backward to force you forward. It inserts onto that gluteal tuberosity on the femur and has its origin up on the sacrum and the ilium, so far back that it anchors onto the sacrum as well. Its secondary function, though, is some of it anchors into that iliotibial tract that we just saw and runs down there to the tibia. And so it also functions in balance. So it has this power function to it in pulling on the femur, and it has this balancing function anchoring down to the tibia through the iliotibial tract. So 4 muscles in this posterior hip area, the 3 gluteals, and the little tensor fasciae latae.